Hey everybody, welcome back to the Outcomes Rocket. Here we are at AHIP 2024 in Las Vegas at the Wynn. And today I have the pleasure of hosting Ashish Shah, the founder and CEO of Dina. Ashish, welcome to the podcast.
Thanks for having me.
It's such a pleasure to have you here. Look, we're gonna dig into the work that you do and how Dina is making an impact for payers, providers, and members. But before we go there, tell us a little bit more about you and what got you into the business.
Yeah, well, I've been in and around healthcare and technology for a majority of my career. Started it really working on solving some pretty big problems around healthcare data interoperability. So building many of the early health information exchange networks in the country, helping connect hospitals and regions to primary and specialty care. And that was really rewarding and wonderful work. And there's still so much to do in that space. But the emerging opportunity that we identified many years ago now was care was quickly shifting into the home and community. And so although it was really important to establish good continuity of care and connectivity into hospitals and primary and specialty care, being connected to where people live and often are now receiving care in their home and community was a big gap in the market.
Yeah.
And so years ago, we set out with a vision of really trying to improve accessibility, reliability, and transparency into a whole multitude of things that can now be delivered in one's home.
That's fascinating. And is this tied to the hospital at home program and that initiative?
Yeah.
Or is it broader than that?
I think it's broader than that.
Okay.
Now, there are some aspects of what we do in terms of organizing care logistics around things like skilled nursing in the home or physical therapy in the home that could definitely benefit programs like hospital at home.
Got it.
But this is more broadly a fundamental need for health plans and providers who are trying to improve access to critical services when it's appropriate to be delivered in their home and community.
Totally. Things such as chronic care management.
Post-hospitalization recovery in one's home. Perhaps you were hospitalized after having a knee replacement and you needed 4 to 6 weeks of therapy. Sometimes you need that in a facility. Sometimes you can do that in an outpatient physical therapy center. But increasingly, it makes sense for that to be delivered in your home on your terms. And so we will help organize a lot of those services. It's a super fragmented market, and the workforce shortage is quite significant there. So trying to identify somebody who can reliably show up within a 24 to 48 hours sounds simple, but it's a pretty large problem for the industry.
For sure. And so a big population that we're talking about here is Medicare Advantage.
Yeah.
Help us walk us through a scenario where you're delivering this service and like a before and after, like before somebody started working with you, then after they started working with you.
Yeah, that's a great question. An example of someone that we work with is a SCAN health plan. So in Southern California, they're working with both those who are seniors, so Medicare eligible, but also underserved. So perhaps, benefiting from a Medicaid benefit, so dually eligible members. And there may be a significant number of dually eligible members that need access to personal care services. So not home health, but non-medical services that assist with the activities of daily living, bathing, grooming, meal prep, things that can really improve overall health and well-being. Prior to our arrival, that was something that was really manually being organized, and it was taking, in some cases, weeks or in upwards of a month plus to arrange, confirm service to be ultimately initiated. We just looked at our data the other day in Southern California. We're now confirming requests within 10 minutes or less.
Wow, 10 minutes.
10 minutes or less.
Wow.
We got some really neat, innovative technology that allows us to establish a really great connectivity to their entire contracted network, both in terms of their preferred, but also overflow capacity. And we really reduced a lot of the friction in that process.
That's awesome. So an organization does all the work, finds all the potential solutions. You guys aggregate it under this system that helps them quickly tap into what's best for the patient at that time.
That's right. We're matching member need to who has the available capacity, has the right quality and financial arrangement as well. And really connecting all of those data points to make the perfect match and recommendation.
That's awesome.
And then streamlining that workflow all the way.
That's great. And when somebody typically installs and turns the system on, what are some of the big like wins for them? Are they financial? Are they outcomes based? Like talk to us about the wins.
Yeah, well, increasingly we're giving them time back to be able to spend time with members, buying time back in their day. So there's a huge workforce productivity component. In one of our recent cases, come back to scan, we're able to boost workflow productivity by 12x. I mean, significant savings in terms of just optimizing workforce, but also creating space to work on the things that need to happen. Secondly, when you're able to actually initiate care in a more timely manner, less bad things happen. Less visits to the ER, less unnecessary visits to the hospital, better compliance with medication regimens, overall broader health and well-being, fewer appeals or complaints that are getting logged into the health system. So there's a number of administrative as well as medical or total cost of care benefits here. And we're quite excited about the data that's flowing through our platform right now. And that's what we do today. Mm-hmm. If there's an Act 2 art service offering, it's much is being written and mandated as it relates to identifying and addressing challenges with health equity. And so a lot of what we're doing is bringing data back from these really critical home-based providers to further identify opportunities to address those gaps in health equity.
That's fantastic. Adding value today, building toward the future, all focused on access and equity. Love it. And here, Ashish, at AHIP, not everybody that's watching us and listening was able to attend. Yeah. So what insight have you seen or heard that's really resonated with you?
A lot has been written around the headwinds that are facing government-sponsored programs. And whether it's Medicare Advantage or Managed Medicaid, there are a lot of challenges that both are facing to manage the economics around their business model. And so the themes that we hear are a lot of actually elimination of benefits to try to get costs under control. But we're also hearing from innovative plans to say, rather than reducing benefits, how do we use home-based or non-medical benefits to really create value and to deal with these headwinds? So I think there's quite a bit of innovation ahead of us, but certainly a lot of the policy changes affecting Medicare Advantage or Managed Medicaid are top of mind here.
Yeah, for sure. And the discussions, I appreciate you teeing that up. And folks, the discussions here have been phenomenal, specific to the topic of access and equity, as Ashish mentioned, just a lot of progress, a lot of challenges, but certainly the thinking is happening.
Yeah, absolutely. And I think in a space like this, there's no one size fits all answer, silver bullet. I think it's going to take a lot of collaboration from whether it's providers and payers working together, but also solution providers and vendors. I think there's a very open, active dialogue and trying to figure out how to perfect what we've started here. And that's what's exciting about, events like this at AHIP, but also others around the country.
Yeah, I totally agree, Ashish. Well, and thank you so much for sharing that for everybody that wasn't able to attend. Appreciate you guys tuning in for this. What would you leave everyone with as a closing thought? And then what's the best place they can reach out to you to learn more about what you guys do?
Yeah, well, everyone can find us on all the social channels. So, Twitter, LinkedIn are the best places. We go by Dina Care, DINA Care Incorporated. So you can Google and find us that way. And our website is dinacare.com. Well, listen, if you're an organization who is prioritizing improved access to care in the home and community, you want that to be more reliable. You want that to be more transparent and focused on your value-based care program, we'd love to help. And sometimes that's starting with post-acute services like home health. Other times it's with new creative benefits like home modification. Our platform does a really nice job meeting plans where they are in terms of their need. But our job is to really make sure that members get the services that they need that ultimately affect outcomes.
That's awesome.
We'd love an opportunity to help anyone who needs it.
There you have it, folks. Very clear value prop and an invitation to engage. We'll leave the ways to get in touch with Ashish and his team at Dina Care in the show notes. So make sure you check those out and stay tuned because we'll be coming out with more insights from AHIP. Ashish, thanks for joining us.
So thanks for the opportunity.